later. As I said, if you've just joined, anyone who has any questions, like personal questions that you want me to cover, feel free to like put your hand up and like just interrupt me when you want to. That's totally cool with me. I will check the chat box, but as I'm presenting, I might not see your question until later. So feel free. Okay. So welcome everybody. I think I'm recording. Yes. I'm Laura. Thank you so much for coming to the power of microbiome testing. Actually, I was feeling super so happy and overwhelmed with joy because I saw this morning that I had quite a lot of sign-ups, and it just really warms my heart to see everybody really enthusiastic and raring to go with learning about the microbiome and how it affects your health and what you can do to improve your health going forward. So it's amazing, and thank you so much for coming on to this journey with me. So no worries, Aaliyah, thanks so much for letting me know. Okay, so quick housekeeping about me. I'll get this over and done with very quickly, but I am a nutritional therapist slash functional medicine practitioner, and I have been for finally about 4 years actually. So I was training to be a nutritional therapist from my early 20s. It's been a 10-year journey now, and I have been through my own health struggles alongside working with other people as well, which has been the most rewarding journey as a practitioner and as a human as well. It's been really nice to work with everybody. I've got some of my own clients in this webinar, so it's really nice to have some familiar faces. And yeah, if any of you want to share your experiences, that would also be amazing, and it will show people what can be found, what you can do, and give them hope as well. So me, I personally still have IBS. I mean, it's really hard to get over, but you know, you can put it into remission for sure. But my whole journey started far longer than when I was diagnosed with IBS in my early 20s. So I'm in my 30s now, and I've had IBS since I was about 21. So I had a gum infection beneath my tooth when I was about 20, and it was debilitating. I could not leave my bed for 2 weeks. If anyone else has had like a gum infection, you know how painful that is. And in the end, I had to have antibiotics to clear the infection. There was no way around it, and I had to have a root canal as well. So after that, the infection went away, but I'm left with this dead tooth now in my mouth, and that causes all sorts of issues in itself. And the reason why I wanted to do both the oral microbiome, gut microbiome, and vaginal microbiome is because you can see the tremendous link between all three microbiomes. So yeah, that was a turning point for my IBS, but this started so much longer before this even came up. So in my childhood, being a daughter of a pharmacist, and in the 90s, antibiotics was, you know, given out like sweets. Has anyone else experienced taking antibiotics as a child, especially for colds and flus, fevers and stuff like that? Did anyone else get that treatment? Yeah. So I was given antibiotics at every opportunity. Whenever I got a fever as a baby, it really did actually mess up my guts. And you'll see later on when you look at my stool test results how much of a lack of good bacteria I personally have, and that's exactly why I have IBS and have struggled for so long. So yeah, that's me, by the way. That's the only picture I have of me bloating, which I mean, no one really likes to take pictures of themselves bloating, but I wish I did take more pictures back then. But I was not content creating back then, so little did I know would I need pictures like that. But anyway, I've never been a bigger girl, but I've always previously always had bloating on a regular basis, on a daily basis, and that would be really uncomfortable because it's not all about looks. It's actually all about being comfortable in your body. If your body is feeling stuck and congested and bloated. It's just not nice to feel like that on a daily basis, even if you're eating, because you know you might be passing on a lot of gas, you might be feeling lethargic as a result, because it's not just about how you look. It's really a 360 approach. And actually, I don't bloat at all anymore, unless I've eaten ultra processed food or yeah, that's it. If I eat ultra processed food, that would be the only thing that would cause me to bloat, or if I eat too much. So yeah, that's me. So we'll go into that in a lot more detail. Before I get started on the whole presentation, I just wanted to let you guys know I do have a new program called the Kickstarter, and it's really a one-to-one program which only lasts for a month, and it's really to get you started, because I do a lot of one-to-one work with clients on a long-term basis, because most of the people who come to me have had health issues for over several years or even just 1 year, and it doesn't take one session to get it solve it or even get relief from it. So I have created this new program for those who want to just dip their toe in, analyze their blood tests, and also have a full consultation to understand exactly what's happening in your body, and then receive a nutrition program and a supplements program that's tailored to you and exactly what you need to do, rather than what the internet says. And then you can get on your way to optimize your health from then onwards. And if you need my support later on, that is totally fine. You can come back to me later. But that is something that I'm offering, and I will talk about that in more detail later. But anyway, so bacteria. Does anyone know much about bacteria, the microbiome, anything like that? Like, does anyone know what the microbiome is? I will tell you. So we have trillions of bacteria in our bodies, and we have got bacteria everywhere, on our skin, in our mouths, in our guts, on the bottom of our feet, in our brains, in our kidneys. You know, there's so much bacteria everywhere. And there's trillions of them, and there's more bacteria of them than there are human cells. So yeah, we're more bacteria than human, which is really fascinating, I find. When I say bacteria, I use that as a simplistic term to encompass bacteria, yeasts, which are fungi, parasites, and viruses, for the purposes of this presentation, because microbes is a more appropriate term, but sometimes it's easier to understand bacteria. So as research is improving and advancing, we are finding that we have this two-way relationship with the microbes. We give them a nice home, and we give them food to live on, because they'll feed on the food that we eat. But they also do things for us, such as make nutrients for us. Some of them make vitamin B12. Some of them make vitamin B6. And also, some of them also help us reduce inflammation as well. They help us fight the bad bugs and reduce your chances of getting infections. So, as I said earlier, I have a really bad lack of good bacteria, and I have struggled with that for years, even though I have been doing as much as I can with probiotics and fermented foods and things like that. But we can see how poor microbiome balance through my childhood has really set me up badly for adulthood. Okay. So next page. From the top to the bottom. So of course, I don't think we've got any men in here. Oh, I can't see actually. Usually I get mostly women, but I think there are a few guys who signed up to the recording. So if you're watching later, I have got a section on the vaginal microbiome, and if you have female partners, that is super interesting and super important to know, because I think it's a completely important topic for both men and women to know, because we all engage in sex, we all share bacteria, we kiss one another, and the bacteria from one person to another gets transferred. And if your partner or even if yourselves are dealing with an imbalance in your vagina, or even on the surface of your skin, if you have a penis, then it's important to understand what it is and what you can do to rebalance it. I think we are all so prude, and we don't talk very much about sexual health, and and things like that. But it's such a normal thing that we all go through. And when we suddenly get thrush or bacterial vaginosis or any infection down there, we all shy away and don't really want to talk to anyone about it. But I think it's really important to talk about. So we will cover that in a lot more detail. But anyway, it starts from the very, very top. We have loads of bacteria in our mouths. There's loads of bacteria, and actually, Hippocrates, the ancient physician, said all disease begins in the gut, and actually he's not completely correct. We now say that all diseases start from the mouth because we have bacteria there. If there's an overgrowth of bacteria, we are going to swallow it, and that will impact the rest of your digestive system going forward. So yeah, it's super interesting. So as you can see, we have a lot of bacteria in our small intestine. In the large intestine. There should be much less in the small intestine. You've got some bacteria in your stomach, but yes, in your colon, your large intestine, you should have lots of bacteria. And yeah, that's where we initially thought we had loads of bacteria. We didn't actually know that we had bacteria in in our brains, for instance, or in our organs, or even in our bloodstream. We didn't know that until quite recently, actually. So you can see, for women especially, as the digestive tract gets down to the anus, that's very close to the vagina, unfortunately. And of course, you can get translocation of bacteria, which causes all sorts of problems. And that's why women specifically are more prone to things like UTIs, urinary tract infections, or thrush, or bacterial vaginosis. So that's why I wanted to cover this. Okay. Bacteria first came to my attention years ago when I saw a Yakult advert when I was a kid, and the guy on the advert went, "Bacteria," because bacteria came in and walked through the door, and I was just wondering, like, what is bacteria? Why is he so fascinated by it? And back then, Yakult was the probiotic drink that was available. There was no Actimel or I can't remember the names of the other brands, to be honest. Activia. Yeah, I don't remember the other brands anyway, but yeah, that was the only probiotic drink out there, and we were just starting to understand what bacteria did for us. But we now, as modern citizens, we have an epidemic of poor microbiome balances, right? So many people have gut issues. So many people have infections because, firstly, we use antibiotics too much, far too much, and it has led to antibiotic resistance, if anyone has heard about that. So in hospitals, there's only a few antibiotics we can actually use now because a lot of the bacteria in our world are resistant and the antibiotics can't fight them. So that is a big problem. We also have over sanitation. We're very clean. Especially when I was growing up, using Dettol to clean absolutely everything was the norm. Also, throughout COVID, we were spraying absolutely everything with alcohol or bleach. Do you remember that? Bleaching our homes in COVID? That was a crazy time, wasn't it? And all these chemicals can be really harmful, not only to our bad bugs, but also to our really good bugs, and we need them to protect us. So when we kill the bad bugs as well as the good bugs, the bad bugs are usually stronger and they win the arm wrestle and eventually can overgrow and take over and cause more problems like bloating, diarrhea, loose bowels, pain in your guts. Okay. So, and if you've ever had a UTI or something, or thrush, or maybe even oral thrush, gut infections, you'll find that if you do take an antibiotic, you're actually more likely to get a reinfection very soon after. So my mum last week had to take antibiotics for a urinary tract infection, actually a bladder infection, it was more precise. So she didn't have access to anything else, but she just took it because she was in quite a lot of pain. But lo and behold, this week, the pain came back. So, antibiotics, UTIs are one of those infections that with antibiotics, they actually reoccur very, very frequently. So it's not always the best option. So looking after your good bugs, the good bacteria, is crucial to preventing reinfection. V, you have asked a question about juice cleansers. Do they strip us of good bacteria? No, they don't actually. They don't do that. They actually sometimes, it's not really proven, they help to get rid of some bad bacteria. Some of the antioxidants might help that. But mainly for the prebiotics are basically the food for the bacteria. They feed the good bacteria. So essentially, juice cleanses should help as long as you're not completely starving yourself by not eating at all. So juice cleanse, if anyone doesn't know, it's a huge thing in Bali where you just drink juice for a few weeks and live on that and don't eat anything else. If anyone doesn't know, I spend most of my time in Bali now, but I do come back to the UK a few times a year to see my friends and family. So that's why me and V know each other. So yeah, juice cleanses. I will go into that in a bit more detail if anyone is interested later. Oops. Okay. Right. So why oral microbiome testing? I did cover this briefly, but I mean, 1 in 5 people in the UK have gum disease. In the US, it's about 50%. And actually, I saw a stat that said 80% of adults have gingivitis, which is the early form of gum disease. And I'm not sure if I believe that because 80% is massive. But yeah, some studies have been showing about 50 to 90% of adults having gum disease. That's kind of unbelievable to me. But I mean, if the studies say so, I don't know if anyone knows someone that has gum disease or anything like that. But yeah, people that I love on Instagram, if I'm absolutely not a dentist, even though I'm talking about the oral microbiome, I'm definitely not a dentist. So if you do have any oral issues, absolutely go to a dentist. I love functional dentists that look at the mouth on a holistic basis because we can see that the bacteria impacts the rest of the body. Ask the dentist, Dr. Mark, I can't pronounce his last name, Buhim or something like that. He is amazing. He is literally like one of my favorite people on Instagram. I totally recommend following him. He has so many nuggets of information about the oral microbiome and how that impacts the rest of your body. So, he talks about how bad oral microbiomes, bad oral health impacts things like cardiovascular disease, dementia, diabetes. It is so interesting. And he talks about also like what types of foods are the worst for your oral microbiome. So, we know that Coca-Cola, fizzy drinks are really bad for you because they're very acidic and they've got a lot of phosphoric acid. Gummy bears, of course, but crackers. Who knew? I had no idea crackers were going to be so bad, but he said that crackers and biscuits and things like that are the worst because they kind of stick to your teeth. If I'm sure we've all had a biscuit or a cracker, we know when we eat it, it kind of sticks to your teeth and it takes a little while for you to get rid of it. So when the carbohydrates in the crackers break down into sugar, they kind of like stick to your teeth and can cause more problems because firstly, the sugar can feed the bacteria, but also the acidity from the sugar can cause more erosion from your enamels. So that's why it's so bad for you. So yeah, totally do that. Oh, I had Dr. Victoria. I'll come to it later. Dr. Victoria is also a friend of a friend. She's in the industry. She's a very well-known dentist, but she's based in Mayfair in London. And she has just done a podcast with the Diary of the CEO. Yeah, this podcast, I highly recommend. It is so good. Totally listen to it in your own time. It's amazing. So she actually runs this test, and I think she's just released her own oral microbiome test, which I haven't tried yet. But yeah, the mouth is where it starts. I mean, how many of us don't actually chew properly? My clients will tell you that I bang on about chewing properly all the time. Um, well, not a lot of us don't chew properly. We inhale our foods. We might even chew a maximum of 10 times before we swallow. But actually, a lot of foods require about 30 to 40 times worth of chewing in order to be digested properly. Because, a lot of the foods, if we don't chew it properly and it goes through to our digestive system, it's going to be pretty hard for the rest of the digestive system to break it down. And when foods are not broken down properly, it gives the foundations of it gives more food to the bacteria. Basically, you absorb less of the food into your bloodstream because you can't break it down properly, and therefore you leave plenty of food for your bacteria, and then that causes bacterial growth, you see. So that's why chewing properly is really important. And actually, it's been so difficult because a lot of our foods are ultra processed. We are eating more carbohydrates than ever. In the UK and the US, the level of ultra processed foods. Now I'm talking about like brioche buns, or for instance, like that last for ages on the shelves, or like cakes, sweets, Haribos, fizzy drinks, all of these foods, they form about 60% of the UK diet, 80% of the US diet. So all of these foods are super easy to chew if you think about it. They're not that, they're not tough like vegetables or meat. You have to spend a lot of time to chew the whole foods, but foods that are ultra processed, the fiber content is super low. It takes you like barely any time to chew it. And so a lot of we don't actually spend enough time chewing our foods and eating mindfully, and that can cause increased risk of poor microbiome balances. So yeah, chewing. So the oral microbiome, really, really interesting. Does anyone have ulcers, bad breath, any issues with like plaques? I mean, a lot of people have plaques, but cavities, fillings, any issues like that, root canals? Okay. So if you have, I would love actually everybody to like stick out your tongue like that. Oh, my tongue's not very good today. Mine's a bit pale today. So if you look at your tongue in the mirror and then look at the color of your tongue, it should be pink. It should be pink and full of color. If it is white, such as mine today, usually it's actually quite pink, so I'm not sure. Maybe it was something I drank earlier. But if it's white, then it means that you've got some biofilm on your tongue, right? Biofilm is basically a sort of glue that is made by bacteria and yeast that make bacteria far more, it makes bacteria stick to your surfaces in your body much better. So with plaque formation, we always hear dentists talk about plaque formation, and we need to brush our teeth to get rid of the plaque. The more biofilm that builds up, the more plaque that builds up. So that's where it all comes from. So it's all really important to get rid of that biofilm if you can. So I always talk about having tongue scrapers, things like that, to get rid of that biofilm, because everybody will produce biofilm. It's in everybody's body. So especially if you've slept overnight and the bacteria are super active, then that can lead to more biofilm formation, and that can increase risk of poor oral health. So yeah, if you're prone to bad breath, if you're prone to mouth ulcers, oral thrush. Actually, I had oral thrush earlier in my 20s. I will tell you about that. If you're prone to all of these issues, then it's really important to understand like that bacteria in your mouth can also translocate to your gut and cause gut issues. Okay. So firstly, this client case. So first client case of the session. This is my client, one of my clients who I actually covered this last week in my blood testing webinar. So this client was getting sick every month. So I'm talking a cold or flu every month. Catching a cold or flu a couple of times a year is annoying enough, let alone every single month. She also had about 8 mouth ulcers at a time. So Everybody's had an ulcer before. It's kind of annoying. It's not really like, it's not going to impact your life, but she had 8. She couldn't, when she was eating, it would cause her pain. 8 is a lot. So, you know, your mouth is very, very sore, and it's not very pleasant. Now, she also had a sweet tooth, and she loved sugar. She was eating a lot of sugar before we met, and she was somewhat addicted to it. And the problem is, bacteria love sugar. They love sugar because it's what they feed on. It's the most accessible fuel for them. There's even research to show that bacteria or fungus or yeast that in the guts that feed on sugar, and when there's an overgrowth, can actually cause you to crave more sugar and to seek more sugar in your diet to feed them. So they send signals to your brain to tell you to seek sugar. So if you've got any overgrowth of candida, which is a really, really common fungal infection that can impact your mouth, your gut, and your vagina, or on your skin. So if you've got any fungal infections, or even on your nails, eczema is also linked to candida. If you've got a yeast overgrowth and you seem to love sugar and you can't kick your cravings, look deeper. Maybe it's not you. Maybe it's the infection that's driving your sugar cravings. Okay. So yeah, this client, her blood sugar imbalance was not very good. So yeah, eating too much sugar, clearly. But she had this is an part of her oral microbiome test, which you do just by like doing a swab from your mouth. And she came up with two types of bacteria that were pretty high. And the sugar clearly was driving the growth of the bacteria, but also the bacteria were causing her mouth ulcers. And you can imagine if you've got poor bacteria in your mouth, all these bad bacteria in your mouth, and that is being swallowed as well, you've got more of an increased risk of catching colds, because colds and flus affect your lungs and your airways and your sinuses, right? So if your oral microbiome is not healthy, of course, you are more at risk of colds and flus. So this client, we actually resolved, we cleared this by using, not antibiotics, but we used like a probiotic mouthwash and a probiotic toothpaste. So if you follow those 2 people on that I tagged earlier on Instagram, you'll find that they talk about not using fluoride, not using alcohol in our mouthwashes. So Listerine, if anyone knows that mouthwash, I think everybody does. That is like literally nuking your body and nuking your oral microbiome. Yeah, basically getting rid of your good bacteria as well as the bad bacteria, because it has a lot of alcohol in it, and it stings like hell when you use it. So swapping your dental products to, for example, a probiotic mouthwash, probiotic toothpaste, even using gum that is more like a xylitol type of gum that can also help to improve the bacteria in your mouth. So yeah, so we cleared that, and she doesn't get any mouth ulcers now. She doesn't catch a cold or flu anymore. So, and it's only been since May. Yeah, since May. From the summer onwards, all of her mouth ulcers cleared away, and she had been suffering for a couple of years. So, but everybody's different. You can get the same results and different experiences, because when I checked my test results, I think mine were worse. So, you know, I have the same high levels of those 2 types of bacteria, but I don't have any mouth ulcers. So I also had high levels of Prevotella, but she didn't. So these types of bacteria will cause inflammation in the mouth, and I'll tell you about my story. So after I had that root canal and also that infection in my mouth, things have never been the same. I've got excellent dental health, as my hygienist says, because I floss my teeth every single night without fail. I brush my teeth with my electric toothbrush. I tongue scrape every single morning and night. I do everything. I use natural toothpaste and all of that as well. But yeah, so I was really surprised. So I did this test in August this year, and had never done an oral microbiome test in the past. And I was super surprised to see this. So so let's go back. So when I was in my early 20s, as you do, you go through a promiscuous phase. And my friend one time gave me drugs, and I've never been an avid drug taker, but I believe it was MDMA, and that, if anyone has tried that, that will dry out your mouth crazily. So as well as cocaine, anything like that will really dry out your mouth. And one time when I had come home from taking that pill, I looked at my mouth and I had candida all over my mouth, and I didn't have that at the beginning of the night. I had patches of white all over my mouth and my tonsils. So I'm talking about this situation. I was horrified. So that is the sole reason why I do not do drugs for myself, because that's what happened to me. And that was so painful. My mouth was so painful at that time. So yeah, watch out for that. So that was the very beginning of when I started to pay attention to my oral health. So that was the problem. But over time, actually more recently, during COVID and after COVID, and even up until last year, I had a persistent cough that just would not go away. Did anyone else get symptoms from COVID that just lingered for ages? Feel free to raise your hand if you want to share your experience. So I had this cough that just literally would not go away. It was highly annoying, and I think it lasted for about a year and a half. So maybe even longer, actually, because now we're in 2024. It's been 4 years since COVID now. So it just would not go away. And it was like the chesty cough that would, you'd produce a lot of mucus, and it was like an uncontrollable cough as well. It was very tickly in your throat. So I tried a lot of things, but it didn't really click with me until a year ago, when I was like, actually, if I just clear the infection of bacteria or yeast, actually, with proteolytic enzymes, and break down that bacteria and clear it, my cough should clear away. And actually it did. And I haven't really had any issues with coughing since then. So yeah, that's my story. Okay, so looking at your bacteria, the next section is your gut microbiome. So let's look at that. So why microbiome testing? Does anyone tried a stool test before? No. Yeah, so I've done loads, and I'm going to show you all of my tests. So microbiome testing, checking what bacteria you have in your gut. Your gut has so many trillions and trillions of bacteria in them. And so many people have IBS and gut issues. Does anyone have gut issues in here? Yeah, a few nods. Okay, so gut issues are so common. 1 in 5 people have IBS. I believe it's mostly women. 60% of those sufferers are women. And also, I was actually quite horrified because when I went into Superdrug a few months ago, I was just like amazed at the range of medication we have for gut health now. And actually, none of these medications will help you in the long run, which was amazing to me. And the whole reason why I do these webinars is really to show people that there's more to this than meets the eye. You don't just, I don't know if any of you've been to your doctor and been diagnosed with IBS, but usually they will be like, okay, you can either have Buscopan or Imodium. Buscopan is to stop your cramps. Imodium is to stop diarrhea. And laxatives are to stop constipation, Or you go on the low FODMAP diet and do an elimination diet. There are options for people of extremely limited in the primary healthcare. But actually, when we look at the research, we can find that actually over a third of IBS patients are actually positive for small intestinal bacterial overgrowth, so excess bacteria. So And actually, I would say most people, literally most of the people with IBS probably do either have small intestinal bacterial overgrowth or overgrowth in their large intestine. Because when we look at people's guts, gut microbiome tests, you can see that there's either too much bacteria or a lack of the good bacteria that is causing the gut issues. So why don't we just solve the overgrowth rather than using that, using medication? Because if we use laxatives to to stop constipation, or just get rid of the pain, we're just basically ignoring the signals that our bodies are telling us. I'm going to speed up a bit actually, because I realize I've got so much more to show you. So getting gassy, if anyone has bloating or excess flatulence, which a lot of us do, this is for you. So, you know, getting bloated and getting gassy is normal, but how much is too much? Are you farting too much, and is it foul smelling, or is it odorless? Is it happening after every single meal? Are you bloating after every meal as well? Is there a particular food that is causing this? Usually when I ask these questions to clients, and if they say that their gas is quite stinky, it smells like sulfur, they've probably got too much bacteria that makes sulfur or hydrogen sulfide. If it's odorless, perhaps you've got lots of bacteria that make a lot of methane gas. So when you bloat, that gas that your bacteria makes, it makes your belly extend, right? Because the mass is just extending your belly. And really, if you've not got any constipation and your gut motility is good, you should be able to pass that gas, and that should relieve your bloating. If you don't have good gut motility and your bloating doesn't improve, then there's something that we need to fix there. We need to look into like whether you've got too much inflammation in your gut, or whether you've got constipation and everything is being backed up too much. A lot of people actually have overflow diarrhea. So if you say that you go to the toilet every single day, but your stools are loose, or you get diarrhea, actually a lot of people are constipated, but their gut is so reactive that their gut is just like expelling your stool quickly. So that's called overflow diarrhea. So sometimes it's constipation but masking as diarrhea. Oh, that's annoying. I don't know why that's not coming up. Anyway, this page was all about this analogy that I like to use, the garden analogy. So I don't garden, but my mum does. I don't have a green thumb at all. I can tell you about gardening, but with the gut microbiome, I can tell you how to garden your gut microbiome. So if you've got loads of bad bacteria, so this client had loads of bad bacteria, including some yeasts, which this yeast particularly is found like in the blue mold that you find on fruits, if you've seen that. And also these really nasty ones as well. So this client had too much bacteria, and when she was taking probiotics, actually her symptoms worsened, because if you try and plant flowers when you've already got loads of weeds, then those flowers will never survive, right? You have to de-weed, you have to nurture your soil in order to plant healthy vegetables, healthy flowers, and blah, 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 right? So this is the main message. So this client actually had a lot of bloating, so much bloating that literally nothing would help. It was the most difficult case of bloating I've ever seen. So this client this is a breath test basically, and showed that her breath test was showing that a lot of methane types of bacteria were in there, lots of hydrogen gas was being produced, and it was all the time basically, and her bloating and constipation was severe all the time. So yeah, tricky one. So small intestinal bacterial overgrowth. I did go through this a little bit earlier, but I just wanted to show you that when your food isn't broken down very well and it's not absorbed very well because you haven't been chewing very well, that gives you the premise of bacterial or fungal overgrowth, and that will cause bloating and lots of gas. And then it goes round and round, and it causes more inflammation as well. And in time, actually, you might develop some food sensitivity. So if anyone's struggling with like gluten, dairy, I used to not be able to eat eggs without feeling lethargic. Sometimes seafood, nuts and seeds, things like that. Sometimes people are sensitive to spices as well. So if anyone's done like a food sensitivity test, and I got this question on Instagram the other day, and the food intolerance tests, food sensitivity tests are so common, and you can get that all the time. And they'll show you what sorts of foods that you are intolerant to. But yeah, when you've got a situation where your gut is very inflamed, you will definitely have some food sensitivity. So I always say, like, actually, don't bother with the food sensitivity test because you're sensitive anyway. You may as well avoid the common culprits, work on your gut microbiome, and then you should be able to eat more food. Okay. Right. I'm going to skip over this. I will be sending out the slides later tomorrow. But I'm just conscious of time. Okay, so another thing that also caused made my IBS worse was in in my early 20s. It was all the rage to drink things like green juices and meal prep. I did a lot of meal prepping, but I also like didn't reheat my food properly and ate cold salads all the time, and that really drove candida for me. So that was a really big issue for me. So I ate lots and lots of plants, and actually that made my IBS worse. And the reason being is because plants are full of fiber. Fiber feeds your bacteria, which is important. But if all you're eating is plants, if all you're eating is just plants and you're not eating anything else like a meat, fish, and eggs, like protein, then your diet is extremely high in fiber, and that will feed your gut bacteria and sometimes feed it too much, and then you might get an overgrowth. So that's why I see a lot of gut issues with people who are on a plant-based diet. Wow, this is my very first stool test in 2019. Wow, such a long time ago. Now, back then the stool tests were really like basic, and you could only see a few markers, and I'll see like my next ones over the next couple of years are so much more complicated. But back then, it showed me that I didn't have very much lactobacillus bacteria. So if you don't know, lactobacillus is one of the most common types of bacteria that you can find in the human body. Most strains of probiotics tend to have lactobacillus and bifidobacteria. Yogurts have mostly bifidobacteria. E. coli is actually one of your commensals, so good bacteria, but it's different, depends on the strain. Some E. coli is like can cause you food poisoning, but others are helpful. So you can see here that my lactobacillus levels are really low, and you'll see that as a trend going forward, because remember when I was a child, I had lots of antibiotics, and really one of the main types of bacteria that antibiotics really wipes out is lactobacillus. So, and I had lots of bacteria that were producing lots of biofilms as well. So that was basically making glue for the bad bacteria to stick. So yeah, that was the premise of my IBS. So my symptoms were bloating all the time. I was also having loose stools, urgent diarrhea, reactions to lots and lots and lots of different foods, and I found it very, very hard. But yeah, I think a lot of my clients actually have had more difficult cases, but I think sometimes we look at the results and it's very, very individual. These results that came up for me were producing quite annoying symptoms, and you might see worsened results for other people. But it's all very, very individual, and it's important to just like look at the whole person as a whole rather than looking at everybody else's data, everybody else's research, and personalize it to yourself. So I had a client earlier this year that was taking Simprove. No, she took Simprove twice last year, and she ended up in hospital because of that. So does anyone know Simprove? It's like really famous probiotic, liquid probiotic that lots of influencers are promoting. So it's quite expensive as well. I think it's like something like £70 or something. I can't remember. But yeah, most probiotics on the market, which are a supplement full of good bacteria, tend to have like billions of bacteria, billions and billions of bacteria. And so it's almost like we think the more bacteria we have, the better. But it's not usually the case. So anytime I took a broad spectrum bacteria, probiotic even, with both lactobacillus, bifidobacteria, and other stuff, I would see my symptoms worsen. And actually, when you look at my test results, you can see that I don't need more bifidobacteria. I need more lactobacillus. So actually, a lot of my symptoms always improve. And actually, lactobacillus helps me put my IBS into remission completely. So that's what I do on a daily basis and ongoing basis, is to supplement with lactobacillus only probiotics. So that's why you should always test, not guess. My second stool test in 2020, I can't believe I did that in COVID. So yeah, actually, this was way better. But still, my lactobacillus levels are really low. So you can see how, like, childhood antibiotic use, and also I was quite a clean child. I didn't really like play in the dirt or anything. Because when I compare my health to people who might have played, like boys, for instance, were playing in the mud all the time, I could look at their microbiomes, they tend to be better. But anyway, looking at my lactobacillus levels, they were really low. So these are your good guys. They are the ones that fight for you. They're your frontline bacteria. And if you don't have enough of the frontline bacteria, then how are you going to defend against the bad ones, right? So I had low levels of lactobacillus, and also this one, Akkermansia, this one was really low. But I had high levels of Prevotella, which actually causes loose stools and diarrhea. So that will be why. And then levels of this sulfur producing bacteria was making me bloat and cause sulfurous farts, which was not very nice. So yeah, I didn't have enough of the good guys. I really needed some of them. 2022, 2 years ago. Okay, so this is a different lab that I use. So the data is not really like easy to understand in comparison to the other ones. So yeah, as you can see, my levels of lactobacillus were way better. They were like normal according to this test. But I had yeast, so I had candida. So annoyingly, someone's joining. Okay, so annoyingly, I had candida, which was like another problem. So back then, I was actually working in a clinic in London, very high-end clinic, very nice, lots of fancy equipment. And I was actually the most stressed I'd ever been, because it was more of a toxic environment than I expected. So I was reacting to everything. Any food that I had, coffee, I was reacting to just eating like anything. I would say I would had loose stools all the time, and I did not know why. My bloating wasn't bad though. So yeah, I had yeast, and I had lots more still biofilm producing bacteria, and I had some of this as well, which was really annoying. So yeah. Stress has a massive impact on your gut-brain connection as well, so that can impact your mental health. If you are stressed, that can halt. Some people get a constipation, so it can halt your gut motility, so you might not be able to poop when you're stressed. Some people poop too much, so that was me. I poop too much when I'm stressed. So let me know if you guys are either poopers or non-poopers when you're stressed. So yeah. Yeah, that was highly annoying as well. So yeah, the next test I did was actually this year, so I didn't do one between that. So 2 years between that. So I went back to that other lab, and oh gosh, it went all back down to low. So was I back to square one, or was this a clean slate? So as a lot of you know, that I in 2021 I decided to go traveling, mainly to Bali and surrounding countries. But I got Bali belly, and some of the people who are watching this webinar later, they'll also be living in Bali, and they've also had Bali belly. And I got a question earlier about that, and how do you stop food poisoning? How do you protect yourself against like the different types of bacteria and parasites that you encounter when you go to developing countries? So that's a really, really good question. So I definitely pretty sure I got a parasite or an amoeba or something when I was in Bali, because I had a periods of food poisoning over the last 2 years. So yeah, but I didn't manage to get a test done because this test isn't really available on that side of the world. So yeah, it really rocked the boat for me. And I'm talking about diarrhea. I'm talking about reactions to certain foods, but yeah, over time I actually got used to the foods in Bali a lot better. But yeah, I did use proteolytic enzymes, and I actually use myself as a guinea pig a lot. So as you would as a practitioner. But please please do as I say, but don't do as I do. So don't always test everything on yourself. But I use a lot of proteolytic enzymes, which were really effective actually. So it cleared all my candida, it cleared a lot of my bad bacteria. But actually I was left with quite a lot of low types of good bacteria. So I need to build it back up. So often when we go back to the whole protocol with killing or actually solving gut issues, we need to understand what your culprit is. So if it's an overgrowth of bacteria, you should clear it, get rid of it first, and then nurture your microbiome. But firstly, by nurturing your soil, fertilizing your soil. So that means your gut wall, your intestinal health, with some healthy things like mucus-producing mucolytic things like aloe vera, for instance, or slippery elm, some prebiotics to feed you good bacteria, fertilize the soil first, and then going with probiotics to help these guys grow and have a nice home to live in again. So what I've been doing since then has been to just nurture my good bacteria. So I've been taking probiotics, prebiotics. I eat a lot of fermented foods. Nothing makes me bloat, and actually my bowel movements are very regular every day. Sometimes I still react, but mostly I only react to spicy foods and dairy. Everything else seems to be good. No, I mean, if you eat ultra processed foods, that's a given, but generally dairy and spicy foods, which I can live without. I will probably allow myself to eat some cheese because I love cheese, but for Christmas especially, but most of the time I avoid these foods and I'm good to go. And my stools are actually mostly well-formed, pretty much well-formed all the time, unless I eat those foods. So I always know if I've eaten something that I shouldn't have eaten. So yeah. So going from having loose stools for most of my 20s to now having very well-formed stools has been a massive triumph for me. So yeah. So, and yeah, I said bacteria from your mouth can get to the bottom in various ways. So yeah, and we know why that would be, but we won't go into that. So the vaginal microbiome. So as I said earlier, if there's any men who are listening, this is so important to understand for your female partners, because I think it's really important to be supportive for one another. So women, us women, a lot of us get things like vulval candidiasis, so candida or thrush. About 75% of women have experienced thrush before. I'm sure pretty much all of us have. Bacterial vaginosis or BV is also very common. So it's both these infections can happen. I certainly did, for sure. STIs, mycoplasmas, and HPV can cause problems as well. So I will show you a case where a client was diagnosed with a mycoplasma, which impacts your fertility massively. But also, she was diagnosed with vulval eczema, misdiagnosed, and we solved that actually. So, so that is the stats. Oh, for me, I'm doing myself first. Okay, so for my test, this test I did was really surprising. So I shared on my stories a few months ago, earlier this year, I think, that I was diagnosed with SIN3. So has anyone had like their smear test to show whether you've got like HPV infections, anything like that? Yeah, so in the UK we should be getting checked like every 4 years. So mine came back positive, and I got the highest level of infection, and that was SIN3. So if anyone doesn't know, we HPV is the leading cause of cervical cancer. And in the UK, we all, as teenagers, we were all made to have the HPV vaccine, and I did have the vaccine. And let me tell you now, the vaccine does not protect you from HPV at all, because we are protected against, or the vaccine helps protect us from about 19 strains, but there are more than 300 different strains of HPV, so it's not completely going to solve everything. So I still got SIN3. Um, so yeah. Do you still find clients tend to get rid of their food sensitivities once the gut is in a good place? Yes, absolutely. Yeah. A lot of clients have lots of food sensitivities in the beginning, and then after nurturing the gut to get rid of the bad bacteria, heal the gut, reduce inflammation, all of that, yeah, your food sensitivities can absolutely go away. So okay, any other questions? Anybody who's got anything, please do pop it in the chat box and I will answer them. So yeah, this test result was my vaginal microbiome. Now, I did not expect this at all because I don't get, definitely in my early 20s, I definitely got more thrush and BV. But I didn't expect it to be this bad because my symptoms were not ever this bad in the recent years. The only episode I got was last year when I was in Spain drinking a lot of white wine. And I did not know that white wine caused so much thrush actually, because white wine is not only more acidic than other alcohols, but it can also have a lot of yeast. So yeast helps more yeast grow. Um, I thought I had candida or thrush, but actually my test results show I had bacterial vaginosis, which was annoying, but definitely something I needed to deal with. Thanks so much, Natasha. See you soon. This will be recorded, so I'll send it to anyone who can't join for the last part of it. So as you can see, I had a high level of bacterial vaginosis causing bacteria. And my pH was bad. It was very high. So as some of you might know, there are a lot of products on the market to keep your pH balance, right? So pH is the acidity versus alkalinity of your body. You can use it to test your pH of your urine, your vagina, mouth, whatever. So the vagina needs to be very acidic in order to keep the bad bacteria gone. So mine was pretty high. Okay, so clearly that was a perfect environment for bacteria to grow. So this needed to be fixed. And because previously I had the HPV infection, I had to undergo surgery to remove part of my cervix cells because that's the only treatment option for people who have been diagnosed with that. And it's actually far more common than we think. There are so many women who've had to undergo that surgery. So that was the beginning of my issues because in this episode, because the surgery, for one, exposes you to bacteria that shouldn't be there because of the surgical tools and maybe the bacteria from the hospital. And yeah, that wasn't really great for me. So that's what had caused an overgrowth of bacteria. So yeah, this can happen to anybody as well. For this client particularly, she had been diagnosed with vulval eczema. So it's where you get eczema, which is a skin condition on the outside of your vulva. And it was itchy, highly irritating, causing her skin to be very dry and flaky, and it was really uncomfortable for her. And you know, sex was very uncomfortable. It was painful. She couldn't really have sex. And yeah, it was just unpleasant. So when we did her first vulval microbiome test, we found that actually she had low levels of good bacteria, or the ones that she wanted weren't really high. Her pH was a little bit high, not that bad, but she had candida, so yeast overgrowth, which causes thrush, but also bacteria that causes BV, and this ureaplasma. So this is basically a special type of bacteria, but it's quite disruptive and can actually cause infertility. So we were really glad to get rid of that, so that she could try for a baby, because she's, I think, currently trying for a baby. So yeah, that was the first test that we did. And then later on that year, we did another one, after clearing the bad bacteria, such as using herbal antimicrobials like garlic and oregano, using proteolytic enzymes. That was all to get rid of the bad bacteria. And the second test that we did, her good bacteria massively changed, and she got all the good bacteria back, which I was so amazed, because it can take years for that to change. Her candida levels were still high, but actually I didn't put the screenshot in, her BV causing bacteria cleared right away, which was amazing. And so did her ureaplasma. So she was overjoyed, because the one thing that she really, really wanted was to have a baby, and she did not want ureaplasma to cause any risk of miscarriage. And actually, I did have another client who had high levels of ureaplasma, and she did end up having a miscarriage, but we didn't find out she had that infection until after. So yeah, we don't know if that was exactly the reason, but it could potentially be the one thing that we needed to do. So after we cleared all of that, her vulval eczema that she got diagnosed with years ago disappeared. So, you know, the whole premise that, you know, once you've got a diagnosis, that's all, you've got to live with that, and you've got to, you know, stay with that diagnosis forever, is bonkers to me. I think there's always something that we can do to improve your health, no matter whether it's a small change, or, you know, improving your diet in some way, reducing alcohol or avoiding alcohol completely, or just reducing sugar. There's always something that we can do to positively impact a health issue, even if the research says there's nothing that we can do to improve this health problem. Okay. So yeah, that was everything there. So I think I'm pretty much on time. I finished all my case studies, so that's really great. Let me know what you think, and if you've got any specific questions you want me to answer. Yeah, so I have a program, the Kickstarter, and I have got a discount for you guys, and you can use the code Christmas to get 10% off. But basically, you get a consultation with me. I will analyze your most recent blood test, but if you don't have a blood test or recent one, you can add one on for actually I can't remember what the mass is, but it's a lot more cheaper if you go through me rather than going directly, and you will save money on the consultation as well. But basically, you get a consultation with me. I'll analyze everything, do a full health analysis, understand exactly what you are dealing with and what your root cause is, and help you tackle what we need to do. I'll also give you a nutrition and supplementation plan that is personalized to you. So yeah, let me know if you want to grab that offer before I take the discount off. I do have other programs as well. If you have more complex health issues, I've got 2 programs that are on a long-term basis, 6 months and monthly, if you want access to that. So let me know if you want a call to chat further. But yeah, let's get into some questions. Do we have any questions for me at all? Please feel free to raise your hand if you have anything. So any gut issues like bloating, any other food sensitivities? Let me see. Steph, did you have any particular food sensitivities can't even say that word now, food sensitivities that you wanted to talk through? What's the main cause? So Kaiser has asked, what's the main cause for low ferritin? So if anyone doesn't know, ferritin is the stored form of iron. Let me see, actually. Oh, I don't know if I've got access. So in my blood testing webinar that I did last week, I went into iron deficiency in depth. So with iron deficiency, often what we find is low ferritin and then slightly raised iron levels, and that is the beginning stages of iron deficiency. The low ferritin can happen due to a lack of iron in the diet, for instance. So if you're not eating enough red meats, or if you don't have enough plant sources, because plant sources of iron are quite not as bioavailable as animal sources, unfortunately. So a lot of vegetarians get iron deficiency. But actually, I had a few cases of vegetarians in my previous webinar that had perfect iron levels, which was very interesting. So your body can adapt. But low ferritin, that can be caused by poor consumption from your diets. It can also be caused by poor gut health. If you're not absorbing your iron from your gut very well, then you, of course, will have low iron levels. Another reason might be inflammation. If your body's super clever, so when your body is very inflamed, so for example, if you've got lots of if you've got diabetes or cardiovascular disease, or or you're obese, you have lots of inflammation in the body, your body will keep your iron levels low, because as if if your car gets exposed to air and water, it can rust, right? Same thing happens in your body. Iron is highly oxidative and can be inflammatory if not controlled. So that's why your body is very clever at keeping your iron levels low when you are inflamed. So I would definitely look into your gut health, firstly, your diet, and whether you've got enough iron. And secondly, I would also look into understanding whether you have any inflammation that's not been working properly. If you've got inflammation, then you need to dig deeper and see whether there's anything you can fix. So why is it not absorbing from the gut? Well, leaky gut mainly. So your small intestine is where you absorb all your nutrients, and leaky gut is also, or scientifically known as intestinal hyperpermeability, and that's where you actually absorb too much through your gut or too little. It can go both ways. So in the small intestine, if you have a layer, your gut wall is one cell thick, so which is really interesting, because your small intestine or your entire intestines can actually span the mass of a tennis court. So the surface area is massive. But if you are trying to absorb nutrients through your gut wall, but you're totally inflamed, like your cells on your gut wall are broken, if you like, your absorption of those nutrients can be really poor. So when your gut is not robust enough and it's not healthy enough like that, then it might be because of bacterial infection, for instance, maybe mineral deficiencies, because you need zinc to help support the health of your gut. If you've got any issues with gluten, for instance, or celiac disease, that can cause inflammation in your gut wall as well. So what are the different responsibilities of the small intestine versus the large intestine from Lacan? So your large, let me just get that diagram back up so you can see. So your small intestine follows your stomach, right? And the small intestine is super long, and it takes like okay, if you imagine food going into your stomach might stay there for about 40 minutes. Sometimes if you've got indigestion, it can stay there for like 30 minutes. But after that, it will go into the small intestine. And the small intestine can keep your food for as short as 4 hours, as long as like 8 to 12 hours. If you've got really bad constipation, then it might stay in there for way longer. And that's your small intestine is where most of your immune system is based, most of where you break down your foods. Basically all of it, basically. So you break down all your foods in the small intestine, you absorb the nutrients. That's why it's so long, so that you can get maximal absorption of nutrients through your gut wall into your bloodstream. It's also where some bacteria help you break down your foods as well. And then once you're all done with your small intestine, you pass it on to the large intestine, where your gut will absorb all the water. So you start to form stools in there. So sausage shaped stools. So tongue twister there. That's where you form them. You also resorb some of the water. A lot of bacteria live in the large intestine. Literally, most of your gut bacteria live in there. And they might make you more nutrients. So they can break down more things like fiber to help you make more short chain fatty acids to help you feed your gut. So yeah, all that, your large intestine is really to do with that and to balance your electrolytes as well. So they do lots of very interesting things. I hope that answers your question, Lakin. Let me know. What would be the reason behind athlete's foot or nail? So, good question. So that is a fungal infection. So if you've got, you'll find that athlete's foot medications are antifungals. So, athlete's foot, if anyone doesn't know, yeah, it's an infection that affects your feet. So yeah, often you can get that from using sweaty socks all the time. I mean, they call it athlete's foot for a reason. A lot of people who go swimming in swimming pools a lot, or maybe share changing rooms where there's more, or showers with other people, you can catch bacteria or funguses from other people, which is not very nice. So yeah, you can get an infection on your toe. What you can do, what is the hidden reason? That could potentially be a lack of good bacteria to protect you from athlete's foot. It could be the environment, maybe the cleanliness as well. But yeah, definitely look into your skin microbiome. Unfortunately, there's not a skin microbiome test, but you can do things to help you improve your microbiome and your immune system to fight the infection. Yeah. Hope that answers your question, Kaiser. Okay. Great. Any other questions at all before we finish off? Okay, thank you so much, everybody, for listening. This has been fantastic. I will be sending out the recording later tomorrow. And if you have any questions, feel free to DM me, message me, and I love to have a conversation and talk more about everything in more detail on my stories, on my Instagram. If there's any other topic you want me to cover, in future, let me know, because I love doing workshops. I prefer doing workshops to speaking on my stories, because I can actually get share more knowledge and not just speak for 30 seconds on there. So yeah, let me know. I think Kaiser just quickly asked, is it caused by any mineral deficiency? I don't believe so. I think it's mainly a fungal infection. But I mean, mineral deficiencies would increase your risk of poor immunity and therefore your susceptibility to fungal infections. Question. What tests do we have to take to know if there is a problem with the microbiome? Oh, okay. Sorry, I should have mentioned this actually, because where can you get your microbiome test actually? Because that's super important. That's the whole point of this webinar. So microbiome testing, you can very much get this from when you're in developed countries like the US, the UK, Europe, the whole of Europe can get access. In Singapore, you should have access. All developed countries have access, and even Australia have microbiome labs as well. So in the UK, I use InVivo, INVIVO. So I'll pop that in the chat now, InVivo in the UK. In the US, in America, I use Genova Diagnostics in the US. Europe, if you're in the rest of the world, I usually try to use Genova Diagnostics because they send everywhere in the world. In Bali, no, there aren't any microbiome labs that I would use, because it's just not really available, unfortunately. Maybe I need to start something over there. But yes, I will be back in Bali like early January. But yeah, it's a tricky thing when it comes to testing in Bali. So if you have access to going to your home country, for instance, I totally recommend doing that and ordering a test when you're back home. Is this way more accessible. And my labs, I have labs all over the world and I can order them to most countries. I have found that it is a bit hard with barley because of the restrictions with import and exporting. So yeah, those are the two labs that I use in those two countries. But yeah, just it's so important to know that, you know, this data is available. Just because this sort of information is not available on primary care services, like especially in the UK, we have the NHS, and when they do a stool test for you, they check for like one marker, which looks at inflammation in your guts. So if you only look at one marker, how can you know exactly what's happening? Like, you don't have the full picture of what's going on in your gut. How are you supposed to actually make a change to help someone with their gut health? It's impossible. So, you know, sadly, these tests do cost money. There will be a few £100, a few $100. Usually a stool test costs around $300 to $400. For one test kit. So, you know, and it's quite a comprehensive one, but it's a significant investment. So that's why I always get clients to do blood testing first and then decide whether you want to do stool testing later, because there's usually lots and lots of things that we can do with your diet to help improve your symptoms. And, you know, when you have got excess bloating, the usual reason is because of gut bacterial overgrowth. So we can do things to help you improve your gut microbiome, such as chewing properly. Before you even get there, you might not have to spend the money, but it is there if you want to. It is there for you to understand your gut health, your oral microbiome, your vaginal microbiome, if you want to. And I don't think anyone should have, you know, we shouldn't gatekeep this information, because it's there. You can get this information and you're entitled to it. And I think it's so important to use data to power your health decisions. So yeah. Yeah, thank you so much, guys. Thanks so much, Kaiser, B, Steph, Lakin. Thanks so much, everybody, for joining me. I will send this all out tomorrow. So enjoy your Christmas, happy Christmas, and I'll speak to you guys soon. Bye.